Good afternoon, friends. I'm Dr. Aajay Shah, and I'm bringing this another great live on this Saturday. I have a special guest, which I'm sure we will learn a lot from her. But let me give you a quick update on our page. We are now about 80,000 followers from all over the world, and I keep insisting that as much America needs our movement, world needs even more so because a lot of the chronic disease, many of the developing countries obviously cannot afford it. So I think we need to make change in lifestyle, not just for America, but for the whole world. And that includes India and many other countries. So we are on Instagram, we are on YouTube. We also started now this healthy cooking demonstration with my wife. So big thanks to Jayshree. Big thanks to our social media director, Hannah. Hannah has helped us to lead this movement, for last 6 months in a tireless way. But today, I have this special guest, Dr. Vasavada. She's from my hometown, actually. She's an OBGYN, an obstetrician gynecologist. She's actually a member of this prestigious Royal College of Gynecologists, a great mom, great leader, a great TV personality, actually. I've seen many of her TV interviews, and a great friend. So let's welcome Dr. Vasavada. Welcome, Dr. Vasavada.
Hi, thank you so much, and thank you. It was a humbling introduction. Thank you so much for being kind.
Thank you. So please tell us where you live now and what type of medical practice do you have?
Well, as you just said, I'm an obstetrician and a gynecologist. Gynecology, I think most people know it's to do with problems of women's health. Obstetrics essentially is a specialty which deals with maternity, pregnancy-related complications, problems, and even a normal healthy pregnancy. I also have a special interest in laparoscopic surgery, which is commonly known as keyhole surgery, which is right now the standard of care. So I do specialize in laparoscopic surgery and high-risk pregnancies.
That's great. And please tell us a little bit about your childhood, where you grew up and who influenced you in your childhood.
Well, as you rightly said, I do belong to Gujarat, which is the westernmost state of the huge country of India. I grew up like very initial years up to my class 4. I was in Gujarat, and then I migrated to Maharashtra, which is I think for all people abroad, Mumbai is the most often heard city. So the capital of Maharashtra is Mumbai. So we moved closer to Mumbai. I did my schooling there, my graduation there, and my post graduation there. After which I moved abroad. I went to Doha, Qatar. I worked there for a couple of years, and eventually I got my postgraduate degree from the Royal College of UK, which is a UK equivalent of the MD, as we have it in the US and in India also. And then in 2017, I took it a step further and did my diploma in minimal invasive surgery from University of Kiel. And we had an exam that we attended at Sharjah, UAE.
Wow, that's a very, very great accomplishment. I think, to be frank with you, I think being trained at these world-renowned places and at this young age and so accomplished is very, very impressive. I want to really talk about this week, which you actually had originally mentioned the importance of this week. This week is a celebration of a World Breastfeeding Week. So please tell
Oh,
us
yes.
the importance of the week itself, and then tell us how greatly important it is to breastfeed.
Well, I think breastfeeding is somewhere I feel it's really not a great thing that we actually have to emphasize the need for breastfeeding. It is something that the lowest of the creatures just does instinctively and very naturally. So when we talk of human beings as being on the top of the food chain and human beings controlling the universe and sending missions to the Mars and the God knows where, Pluto, and exploring the galaxy, I feel somewhere in that mission of exploring outside, we've sort of not been a lot in touch with our roots, with the busy lifestyle, with some very good things like women doing a lot of work outside, which is excellent. But in doing so, somewhere these basic instinctive things that were second nature to us, or that were nature to us, we have somewhere started ignoring. And which is what came to the notice of health organizations worldwide, WHO, UNICEF, and other organizations. And they realized that a lot of myths and a lot of misunderstandings about breastfeeding, when it should be started, for how long it should be continued, whether it really is beneficial or not. There were a lot of these questions surrounding women's minds, and somewhere they were not able to get the correct answers, and which is why there was a lot of shift towards artificial products like powders and other things to feed their children. There was a lot of in developing countries like India, we had a tendency to start aping the West blindly. And they thought that, okay, because abroad people are and in those days there was a huge shift from breastfeeding towards bottle feeding, that it sort of started aping the West. And it started showing on our statistics. If you look at the statistics right now, there are just about 30% of the babies that are breastfed within the first hour of birth, which is something that's really not something that you should be proud of. And this is an average if the entire country. If you look at certain states like Uttar Pradesh, Bihar, and other certain parts of India, the breastfeeding rate in the first 1 hour is almost just about 25%, which is 1/4 of the babies born are breastfed within the first hour. Now, why we are so concerned about making sure that the baby is fed in the first hour, the reason is that the initial milk that is produced by the mother's breast is what we call as colostrum. Colostrum has a very, very rich, supply of immune cells, actively, moving live immune cells that can do a host of good to the baby. Also, it's the first hour where the baby has also gone through a tiresome journey of labor, and it needs, or he or she needs, a lot of energy, a lot of things to tide over, make sure that the baby is able to maintain its temperature. When the mother breastfeeds the baby, there's of course a bonding because of the proximity. So all of these things tend to get ignored if breastfeeding is not started within the first hour. Which is very important. Again, a lot of women do actually start off on that journey, let's say in the 2 or 3 days time to come, but they are not able to sustain it. Ideally, it is said that up to 6 months, it should be exclusive breastfeeding. Well, there are now new schools of thought that say, up to 4 months, and after 4 months, you can start adding weaning foods for the baby. But at least if you even look at the lowest limit, it is 4 months. So 4 months of exclusive breastfeeding, no water, no honey, no, a lot of other ideas that sometimes I see floating around. Nothing of that sort. The only thing that goes to the baby is mother's milk.
No, I mean, that's an excellent, excellent description. And I think that's very, very alarming. Like you said, human being on the top of the food chain, we would be smart enough to understand that if the whole universe is doing it, why wouldn't we be doing it? Number one. I mean, that's just a common sense. Even if you're not very educated, that just makes common sense that if you see the animals doing it, there must be something good to every creature, number one. Number two, the numbers are very frightening. If it's 13%, that means that many of the poor and middle class people are also not breastfeeding. And I think many times they might be spending a lot of their resources in this expensive processed formulas, and they could be just having this almost like a no cost, all from natural source from the mom. And so in terms of cost saving, it's very important for poor and middle class also. But I think the thing
Absolutely.
I learned from you is that breastfeeding has this tremendous amount of immune cells. I always thought that breastfeeding is good for protein, and certain carbs for our microbes. But even the presence of immune cells is very important. So tell us a little bit about this this role of this. I think it's called monosaccharide in the breast milk, which has been quoted now as one of the very important thing for newborns' development of microbiome.
Right, absolutely. So as we talk about, let's say, the important things that breast milk gives a newborn, one of them is active immunity, which are cells that are cell-mediated immunity. It also gives antibodies. So if the mother has sort of gone through some infections during pregnancy, there is this passive immunity that has developed in the mother in form of antibodies. In this corona times, we talk a lot about antibodies, active immunity, how to improve your immunity. So, well, here it is for you. If you want your child's immunity to be great, this is the start that you need to give your child. So that's one. Talking about the microbiome, there are these oligosaccharides, which are small chains of carbohydrate. They are not, polysaccharides are more complex and they are longer molecules. Oligosaccharides are smaller chains of carbohydrates. So they're easily digestible by the baby, and they help in developing lactobacilli. Of course, the breast milk also has lactobacilli, which are healthy bacteria which help the baby digest better, and they also help the baby in terms of being able to pass their first stool, which is the meconium. So this is the way that it helps the baby. It also helps developing the baby's brain. There are a lot of essential fatty acids, which we in medical terms call it as, but I mean, not just medical terms. Now there are a lot of, advertisements which say DHA, that's docosahexaenoic acid, arachidonic acid, which are extremely important for developing the connections in the neurons and ensuring that the baby's intellect is optimum. And later on in life, babies that are solely breastfed have shown to have a much better, intellectual capability. They are calmer, they cry less, they are less prone to obesity, blood pressure, and other metabolic problems. So all in all, breast milk is a wonderful start, and in fact, it is the best start that you must give your baby. The other important thing, there are a lot of women who say that, okay, I don't want to give my breast milk, but I give cow's milk because, apparently that's the best. Now, cow's milk, if you take it per se, it has a much higher percentage of protein compared to breast milk. Now, a newborn's kidneys are not mature enough to take care and metabolize all that protein load. And a newborn, because our human brains require a lot of, cows are not as intelligent as human beings. Right. We always boast that we are the most intelligent. Now, the brain, the only energy source that the brain needs is carbohydrates, which is why human milk has a much higher percentage of carbohydrates compared to proteins. Cows are, associated with more of physical activity. Humans, we pride ourselves in being more intellectually endowed, and which is why human milk is best for a human baby. Cow's milk is best suited for a calf, and thereon, and so on. So, which is why it's not really advisable to experiment. The proportions of macro and micronutrients present in breast milk is optimum, and that should be given without trying to outdo what nature has already done.
Yeah, no, I think I agree with you completely. I think cow's milk is meant for the calf, and the way the growth of the calf happens over first 3 months, 6 months, and 1 year, it's actually exponential. I think they grow from a small calf into a big cow within a year. And I think humans are not meant to grow like that. So a lot of the protein, a lot of the growth factors in cow's milk is not suitable for human health. And I think many of the future issues, including some of the development of cancers, happens in people who start cow's milk early and
Absolutely.
continue cow's milk in their teenage years and in adult years. So I agree, cow milk should be, in my opinion, should be not used, and if anything, should be used minimum. So that brings up an important topic. We always talk about mom's health when it comes down to breastfeeding. I think, to be honest with you, I think many moms feel like at times they are not healthy themselves. They don't have time. So, what is the role of mom's health, and what kind of nutrients and supplements mom should take, number one? And number two, if mom is working full time, working long 12, 14 hours, is there any alternative? I always see that many mom can actually have a breast pump and collect the milk and give the child at a later time.
Yes, very importantly. Now, the first thing that whenever you realize that this is a priority, that's when a lot of things start to fall into place. So, talking about the advantages that breastfeeding has to a baby is very nice, but we must not ignore that breastfeeding is actually very, very important for the mother's health as well. So, when a mother is breastfeeding, not only it's much better, it calms her down in terms of her emotional health, her psychological health. It's shown that mothers who are breastfeeding have much less incidence of postpartum depression, postpartum blues. It keeps the mom happy and going. The other most important thing that will appeal to, I'm sure, all the women out there is that it helps you lose weight, girls. So you're not going to miss this opportunity to make sure that your baby is doing well and that you're losing weight without hitting the gym, without compromising on your diet, eating what you like, nutritious, of course. But again, that's a very, very big plus point for moms. The second very important thing is you're much less prone to any kind of infections of the womb if you're breastfeeding the baby. The reason for this is when you're breastfeeding, there's a hormone called oxytocin that's released, and that actually helps you to contract your uterus so that it goes back to its original shape and size, which is just about the size of your fist. So again, this is very important in terms of your overall health. The other very important advantage for moms in the long run is that they are less prone to ovarian cancers. They're less prone to breast cancers. In fact, that's one of the very big risk factors that we look for if you're looking for screening for breast cancers is that if you've never had babies, if you've never breastfed a child, then your chances could be much higher than somebody who has. So it is doing a lot of good for yourself while actually doing the best for your child. So this is something that definitely that needs you to give it your time and give it your priority. Don't shove it under the carpet as something that's, oh, I had the baby and I'm done now. And if you look at the practical aspects, I think nowadays a lot of government organizations, a lot of private sector companies also are strictly following the 6-month maternity leave, which is absolutely for the same reason. So even if you used up a month or two in problems, during pregnancy, you still have those 3-4 months of maternity leave, which is meant for this. So there's no reason to hurry back. Work is not going to run off anywhere, but this time that you're going to spend with your baby, taking care of the baby's health and your health is perhaps not going to return a lot of times in life. So prioritize breastfeeding, very important. Talk to your employers about a paid maternity leave. I think that's your right. So there's nothing wrong in claiming that. There's no point feeling guilty for losing out on those 4 months or 6 months because you're investing it in your child's future in every manner. In terms of pumping breast milk out, that's always an option and a possibility. You could pump breast milk out, fill up in bottles. You could refrigerate human breast milk for up to 1 month. And if you do not even refrigerate it, you can use the morning pump milk till evening or till the next morning even. Human breast milk is quite resistant to getting denatured or spoiled like other milk is. So this is always possible. If you have a caregiver at home, let's say your mom is coming or somebody's coming to help you, if you pump the breast milk, your baby can always have it at a later time without any problems.
Those are excellent points. I think many times we don't realize that breastfeeding actually, like you clearly define, and I think there are probably a lot more benefits than even we discussed. I think including postpartum depression, including maternal weight loss, including uterine going back to normal size, including breast cancer, including ovarian cancer. I mean, these are just some of the benefits. There are probably books written on benefits of breastfeeding.
Absolutely.
And I think I agree with you. I think as a mom, if you obviously everybody's financial resources are different and everybody may not have the same benefits at their work or may not have the luxury of finances, but I agree. I think they all should strive to take at least 3 to 4 months off if they can medically, if they can financially afford it. And if not, definitely reaching out to the breast pump and collecting the milk, and then whoever is providing the care while you are going to the work is a reasonable alternative. So I think to me, breastfeeding, one of the important topics we covered today. I think I want all of our viewers and listeners to understand that the breastfeeding is one of the best thing can happen to mom and the child. The benefits will last for not just years, for decades. And many times, even I've heard that some of the benefits are get transmitted even to the grandchild. So I think, to me, breastfeeding is must. Let's change our gears and let's talk about mom. There's always a question that there are questions that what are the most important precautions a young woman take when she's going to get pregnant, like pre-pregnant precautions, including certain supplements and omega-3s during the pregnancy importance, and then during the delivery itself. So please be as detailed as you can be. but pre-pregnancy precautions, during the pregnancy precautions, and at the time of delivery precautions.
Well, I think pre-pregnancy, one of the most important things that you could do for yourself and for your a good pregnancy outcome is to make sure that your weight is optimum for your height, so to say that your BMI falls within a normal range. If not, make all the efforts that you can to sort of bring it there. If you have a hormonal issue, make sure you fixed it. If it's just lifestyle factors, if you have habits like smoking or alcohol, or you're doing some recreational drugs, get that in order. It's time to clean up the house if you're planning to bring another new life into this world. So I think that these things are very important. Very less often that a doctor will actually tell you to do all this, because most of the times it's about symptoms, diagnosis, and treatment. But this is the ground and this is the base on which a healthy pregnancy is built. So most important, optimize your weight. If you're too thin, well, gain weight. Eat right so that you're in the optimum weight zone. I see a lot of people, going for IVF treatments, artificial fertility treatment, and the basics, which is weight, optimum hormones, that's not addressed. And then you go for cycles of IVF after IVF, and you have no outcomes, and you're left wondering what's wrong with me. So, this is perhaps the first step. Apart from that, we normally ask for, a lot of couples nowadays come to you for, planning for their pregnancy. Perhaps in my days, we did not have anything like planning for a pregnancy. Pregnancies just happen once you get married. But nowadays, couples are much more aware. So it would be, I guess, very important to start with your blood group, your husband's blood group. If you're a negative blood group, well, there are certain repercussions which you need to discuss with your doctor. Certain injections that you might have to take extra during your pregnancy and after the child's birth. So starting from your blood group. It's also wise to get your thalassemia checked, your partner's thalassemia checked. In case you're both minor, there could be a possibility that the baby is a major thal. Apart from that, your HB electrophoresis to rule out sickle cell anemia and all these other, hematological disorders. If you're a pet owner, I also like to run, or if you're working, let's say you're a teacher in a primary school, or you're working in a nursery as an attendant, I'd also like to rule out certain communicable viral illnesses that children pass on. And you might just be asymptomatic, but you might be positive for them, which is CMV, rubella, toxoplasma. So these are the common things that we want to rule out and screen. And especially if you're owning a cat, then again this assumes great importance. So we try and rule that out. We just do a basic check on your thyroid hormones and your glucose levels, your blood pressure, to make sure that the ground is clear in case you want to go ahead and have a pregnancy. Apart from this, from the point of view of supplements, it would be, I think, just folic acid supplements, because that's very important in terms of a proper neural tube development for the baby. Again, it's not a compulsion. I get a lot of patients, not in India, but when I worked in the UK, let's say, there were a lot of moms who said that, no, I don't want to take folic acid. So it's, at the end of the day, it's the mom's choice. But I would definitely, recommend that they take folic acid supplements. It's not going to do you any harm. And if you pop a few folic acids, it's just going to be good for the baby. So if you're planning a pregnancy, you could start off with a folic acid supplement without any worry. In terms of during pregnancy, again,
let me repeat what you said, because I think it's
yeah,
worth repeating for our listeners and viewers. So I think what you said, that moms or future moms health is very important, and that includes maintaining ideal body mass index. If you are lean, very lean, like body mass index of 20, 21, maybe gain few pounds. If you are overweight or obese, maybe lose some pounds, number one. Number two, check for pre-diabetes or diabetes, check for your thyroid. Number four, if you are smoking, obviously quit smoking ASAP. Same with alcohol, same with any kind of street drugs. So I think, like you said, we have to get our mom's, future mom's house in order before she gets pregnant. I think pregnancy is a major an event,
journey.
life, a
Yeah.
major journey, and we want to make sure mom is fully prepared for it, just like we prepare for any long journey. This 9-month journey is longer than any journey any person would ever take. So I agree with you. I think in terms of some of the important things you mentioned about certain infections, checking as simple as checking the blood groups, planning the pregnancy when you are ready financially, when you're ready time-wise, when you can plan your time off from the work. So I think I agree. Like my parents, my grandparents, like you said, when they got married, as it was assumed that within 6 months they will be, mom will be, wife will be pregnant. And then when I was
Absolutely.
growing up, it was pretty much same again. But now I think we are, as a human, we are advanced enough that a man and a woman should plan, not just health wise, but in terms of finances, in terms of their living conditions, in terms of their support, in terms of their babysitting. I think everything else will be important to plan the pregnancy. I agree with you. There should not be, or there should be very few unplanned pregnancies now. So please go ahead and tell us
Absolutely.
about during the pregnancy now.
Right. So now again, if you've taken it forward in this the correct manner, normally as soon as you get pregnant, you would you would know you're perhaps pregnant if you've missed a period. But if you've already been on your folic acid supplements, the first 4 weeks or the first 5 weeks of development, when you're not even aware that you're perhaps pregnant, the folic acid has taken care of the baby's development. Now, the baby's neural tube or the spinal cord, that eventually the neural tube turns into the spinal cord, the brain, it is going to develop by the time the baby is around 8 to 9 weeks. So the first 4 weeks or the first 5 weeks is going to be 50 to 60% of the overall development of the baby's brain. And if you've already been taking prenatal vitamins in terms of folic acid, you've taken care of that period, which otherwise you'd be caught unaware. So, going into a pregnancy pre-planned, this is the first advantage. Now, when you miss a period, you would again want to go and see your doctor. Depending on how much advanced into the pregnancy you are, we normally ask for, if it's been a while since you've had your, blood test for the pregnancy or the pre-pregnancy, we'd like to repeat certain blood tests. We'd also like to repeat certain, infectious diseases such as HIV, hepatitis B, hepatitis C virus, certain things that could be complicated, during pregnancy. If you have that infection, those are taken care of, or those are looked for. Apart from that, if you've not had any of these pre-pregnancy tests, those could be added at this juncture again. The initial part of the pregnancy, which is the first 3 months, we don't normally add any more vitamins or iron or any of that sort. We continue you on just the folic acid. We do not expect you to gain a lot of weight during the first 3 months. It could be just somewhere between 1 to 2 kgs in the first 3 months of your pregnancy, if you are of an optimum BMI. So if your BMI is between 18 to 25, let's say, you could gain overall in your entire pregnancy somewhere between 11 to 13 kgs. But if you started off with a BMI that's extremely low, so let's say you were a BMI of 17 or 16, then, sometimes because you're such a less BMI, you might have trouble conceiving. But if you did conceive, then your weight gain would be that much more, because you need to yourself get some fat into your system. And similarly, if you've started your journey with a very high BMI, let's say you're a BMI of 32 or 35 and you're in the obese zone, then you need to not gain a lot of weight during your pregnancy. The only weight gain that we want to see is maybe 1 or 2 kgs. Apart from that, rest of it is the baby's weight, the liker around the baby, the increase in the size of the uterus. So lesser weight you gain if you've already started off with a higher weight. That's how it goes. Now, apart from that, in the first 3 months of pregnancy, nausea, vomiting is one of the most common complaints. So we might give you medication to take care of that. We recommend a lot of fluids, a lot of electrolytes to be consumed, fresh fruits, vegetables, at least 5 portions of, fruits and vegetables in your diet. Of course, that's not just during the pregnancy, it's even otherwise, but even more importantly now that we're embarked on the journey of pregnancy. Of course, again, if you're working, you could continue working. There's some people who look at pregnancy as some kind of a disease, so they feel that, oh, now that you're pregnant, you're not supposed to move out of bed, you're not supposed to walk, you're not supposed to. That's an extremely wrong thing to do. You must continue any form of fitness that you've already been doing. I would not say add something in, but if you've been an acrobat so long, you can continue some basics. But if you've never moved a finger, you don't suddenly jump in and decide to start doing acrobatics when you're pregnant. So be reasonable about what kind of fitness you're doing. I think it would be safe to do any kind of a walking. If you're comfortable doing cycling, you could do that, but just make sure that you don't fall off or have any accident. Swimming, I think, is one of the activities that if you can do that, throughout pregnancy, it is something that can be continued, it is safe, and it has the least chance of you hurting yourself or the baby. So these are the basic things: diet, exercise, fitness, a good healthy lifestyle. If your husband is smoking, this is definitely the time to put your foot down and say that no smoking in the house or no smoking around where you and the baby are. Even pre-pregnancy, husbands can decide to quit smoking, because smoking reduces your sperm count and thereby your ability to have a child. So quitting smoking for both the genders is a wonderful thing and a wonderful start. Um, so early pregnancy, I think just this, when you go forward into your pregnancy, normally you have your anomaly scans, one which is an early anomaly scan which detects early onset of genetic abnormalities that could be picked up on an ultrasound scan with certain blood tests. There is another anomaly scan that comes in somewhere around the 5th month or the 20th week, and thereafter, if everything is gone on normally, we just want to keep a watch on your blood, on your urine, check your weight and your blood pressure every time you visit us. And make sure that the baby is growing well by routine or serial growth scans. Um, if you've been doing everything right, you should reach the end of your pregnancy without any problems, fully continuing the other side of your life. So if you're working, you continue working. If you're doing some physical activity, you continue that, and before you know it, you're going to be due.
Yeah, no, I think those are some excellent points you made. I think even though pregnancy itself is a natural thing to happen, has been happening for millions of years, but still, I think being, smarter of a generation now, we have to be protective of mom and the child, and the person. So I think, to me, I agree. I think those precautions are important, and those precautions, fortunately, are readily available all over the world. Infant mortality rate has gone down, pregnancy care has significantly improved. So take advantage. I think don't ignore doctor's visit. I think if your doctor recommends to have a glucose tolerance test to diagnose the diabetes, make sure you take a time and effort to get it done, because we know pregnancy diabetes during pregnancy is not only bad for the mom but also bad for the newborn. I
True.
think so. I think
True.
those precautions are very important. Obviously, your the person, the woman's own obstetrician will guide through all those precautions. But knowing and being proactive and asking your OB that what things I should do is very important. Like you said, a woman has to take the charge, because at the end of the day, it's her body and her baby. Doctors are doctors; they will do their best. But at the end of the day, doctors are busy, and many times, they oversee a lot of things, and that's where a lot of education, like bringing you on board here today, I think is the reason, because I want all the young mom, young women to know that when they get pregnant, there are a lot of resources available. So that brings my next question. The vaginal birth rate has gone down compared to 50 years ago, 30 years ago, and that rate is still down right now, even though we have realized the importance of regular vaginal delivery versus the C-section. So please tell us
Yeah.
plus and minus, and what are the circumstances where a C-section is very appropriate?
Well, I think, at the end of the day, the target that the gynecologist or the obstetrician and the mom and the family should have is to have a healthy baby and a healthy mom at the end of it all. That's what we all, wish for, and that's what we all are working for. Again, it's very important. While it's very good to have a normal birth, there's nothing like having a normal birth, but it's very important to also understand that a normal vaginal birth is not the same as a vaginal birth. A normal vaginal birth is something, by definition, that the contractions or the pains should begin spontaneously without any medication or without any help from outside. It should be pains that have started at the end of the pregnancy, which is at term, not earlier, not later. Again, it should be a baby of a healthy weight, a healthy size, and it should be spontaneous in the onset, in the course of it. It should be, completed in a normal period of time, and there should be no use of any cuts. There should be no use of any instrumentation. That's what you would call a completely normal vaginal birth. Now, unfortunately, that is something that no doctor can tell you that you will have a normal birth, because when we say this lady had a normal vaginal birth, it means that she had a normal birth. it's a retrospective term. So once it's done, we can say that it was a normal birth. But till then, yes, we can also always segregate into a vaginal birth versus a C-section. Now, most of the times, a vaginal birth is possible. Certain times, if the pains have not started, or there's some reason that we are worried for the baby being inside the mom's womb, or sometimes that we are in doubt of the mother's well-being versus the baby's well-being. These are the times when we want to deliver the lady much sooner than perhaps her due date. And in those cases, our first option would be to induce the labor. Now, there are a lot of ways that we induce labor. Most of the times, we give something called as cervical rightening agents, which helps to soften the cervix up. There are a lot of scores. The most important one, which we normally use, is the Bishop score, by which we can, grade if this cervix is more likely to go into softening and grow into labor compared to another one, which is perhaps a little less, depending on the position, the length of the cervix, the consistency of the cervix, and many other factors. Now, if we are happy to soften the cervix and begin the procedure, ideally after 6 hours or 8 hours we expect the contractions start. If the progress is good, we then do something called augmentation of the labor, where we give medicines so that the process that has begun is moving forward in the correct manner. And at the end of a successful induction and augmentation cycle, we hope to deliver a healthy baby to a healthy mama. So this is how we deviate slightly from the absolutely normal birth, but yet continue to have a vaginal birth. Now, a birth could at any point, either giving the induction or during the course of the pregnancy, or during the course of the delivery process. There are so many junctures at which, if things are not proceeding well enough, or if we feel that the baby's heartbeats are not doing well, many a times, if you're not satisfied with the parameters, we need to go as an emergency cesarean section. Depending on how emergent it is, normally cesarean section categories category 1, 2, and 3. And depending on how emergent it is, it could be done as within 30 minutes of the decision of doing the cesarean section, the baby should be delivered. It could be fast, or it could be that we give you 24 hours and see, and how things are going, and then deliver the C-section. So definitely C-section is a boon. If you look at the maternal mortality rates, they have significantly declined. And I think one of the important reasons for that is that now we have access to cesarean sections, even in the remotest rural areas. Doctors do them with great ease. Again, if the recovery post a well-done cesarean section versus a well-done vaginal delivery. But yes, I would still say that if you're able to have a smooth vaginal delivery, if you don't have any complicating factors, it should be the first time on your priority list to try and have a vaginal birth. But a lot of moms feel very disheartened, and they feel very depressed and broken that their dream of having vaginal birth, sort of was crashed, and they had to have a C-section. But I would say that, consider yourself lucky that you have an option of taking recourse to a C-section, and at the end of the day, having your health intact and the baby's health both intact. Yes, there are a lot of abuses of the same thing. The reason is that since this procedure is a lot under the doctor's control, and a normal vaginal birth, a doctor is up against nature, and things can go this way or that much more commonly in a natural birth versus a C-section, that sometimes due to various reasons, sometimes because of absence of proper staff, sometimes because of not much of time between patients, and sometimes just because maybe the obstetrician is not completely sure that you can make it in a normal delivery, that C-sections are sometimes on a higher side. Of course, in countries like India, there are a lot of medical legal issues that obstetricians have to face. C-section is kind of an easy way out for them, and sometimes it's even the mothers who request that we don't want to go through the ordeal of a normal birth. We'd like to, go in for a C-section. It helps them plan better. It helps them, organize their household, organize who's coming in, what time, taking leave. All of that is a little more sorted if you had a timely C-section. So I would say, considering that now C-sections are quite safe, there's nothing to be fearful of. But the first priority should always be trying to accomplish a normal or rather a vaginal birth if you can.
And I think those are excellent points. And I think I agree with you completely that now that we have availability of these safe C-sections, we should take
Yeah.
advantage of it whenever necessary, both for mom's well-being and obviously baby's well-being. And at the same time, I think my first recommendation to all my friends and family and all the patients that know your doctor well, trust the doctor. If you feel the doctor is going to do the best thing for you, and if that doctor knows you for 9 months, and then if he or she recommends to a C-section, the relation you have developed, the trust you have developed, will be the right decision. And I think I agree that C-section sometimes is a must. And at that time, having this preconceived notion that I want to go through a normal vaginal birth may actually harm your psychology, may even harm your recovery from a C-section. So I think have all those questions discussed with your doctor much in advance. Also, I think develop that trust and rapport with your doctor in the first few months, and if necessary, change your obstetrician. But go to the obstetrician
Absolutely.
who you will follow the advice at the time of critical time of delivery and not have a second thought that whether my doctor is advising me right or not. I think that kind of thinking should happen in first month of pregnancy, not the first hour of delivery time. So
Labor.
I think relation with doctor is going to be very important in terms of who gets a
Very
C-section. So let's change
true.
some gears now. Let's talk about an important disease, and that applies to many young women, many women, all the women. Is the concern with the cervical cancer. So how do we diagnose it? How prevalent it is? What are the symptoms? And how a person can prevent and treat it?
Well, this is one of the most important topics that we all should sort of talk about and make each other aware. Cervical cancer is the number one common cancer amongst women in developing countries like in India. Also, it is one of the first causes that perhaps is a cancer that kills you most oftenly. So I'm sure nobody would want to have a choice of a cancer that you could get, but I guess if you could have a choice of you need to have some cancer, so choose which one. Don't put cervical cancer at the top of your list. I think that should be something that you should never choose. The reason for that being that the early stages of the cervical cancer, you absolutely have perhaps no symptoms. At the most, you might have some vaginal discharge, and I'm sure most women here will agree with me that we don't really regard a vaginal discharge as something really important. We normally self-medicate ourselves with over-the-counter creams, potions, drugs, or we ask that work colleague whom we really trust that what was the thing you used when you were having a slight discharge the other day, and sort of do all that girl ganging up against a discharge. But as I always say, the smallest complaint regarding your health, you should go to a specialist who can evaluate you. It just could be that you have an erosion or a small ulcer on the mouth of the womb, which is the cervix. If you leave this ulcer untreated, or if you treat this if you undertreat this ulcer, it might make you feel better for a while, but again it can relapse, and eventually these ulcers are going to lead you towards a cervical cancer. And it doesn't come with alarm bells or any warning signs. It could overnight change from just an ulcer to early stage of a cervical cancer. Now, while this is all the bad news about cervical cancer, there's great news about cervical cancer too. Most importantly, that it is one of the commonest, easiest cancers to screen. All you need to do is visit your gynecologist once every year. I'm sure you have that much of, those 15 minutes in a year from your busy schedule that you could go in for your pap test to your gynecologist. If you've had your pap tests regularly and they are all good, then you have ticked off a major cancer off your list. Now, for younger girls who are now, let's say, in the age group of 9 to 12 years, or even up to 16 years, girls who are not yet sexually active, mothers of such girls must know that there is a vaccine that can help your daughters not have cervical cancer. Now, those vaccines are basically against a virus called a human papilloma virus. These vaccines are, certain strains of the human papilloma virus, which have been known to be causative agents in 97% of the cervical cancer specimens. Having said that, it basically means that if you manage to not get infected by the HPV virus, you can effectively negate your chances of having cervical cancer later on in life. Now, HPV again is one of a very common viral infections. Two to three out of four women who are sexually active might be already infected by this virus. But most of the times, like we are also seeing with COVID, most of the times these viral infections heal themselves. You'll never even know that you had an HPV viral infection. It's not coming with those big drums that, oh yes, you got infected. It's something that just passes off. In certain individuals, these persist in a dormant stage. In certain individuals, they cause erosions, and in some, these erosions progress on and go into full-blown cancer. So if you just take care of these two things, regular pap tests and vaccinating your daughters, your sisters who are in the age group that they can be vaccinated, then I think a huge burden of a very, very deadly cancer would be eased out for women.
No, those are excellent recommendations. I think as a parent, we have a responsibility to take care of our daughters and obviously sisters. And I think we have to make sure that they get yearly pap smear. And like you said, it's a 15-minute of your lifetime, and just go and get it done. And most women, actually, most girls actually have good insurance. I think it's just a matter of setting the priorities, and that's what I think.
Right.
Like today, will wake up many people. And second thing is
Right.
consider that vaccine, because I think if it's going to prevent one of the deadliest cancer, why not? And I think
Yeah.
so cervical cancer, I think, like you said, is preventable and is easily diagnosable and is easily treatable. So be smart and take care of it. So let's go to the next question, which is a very, very popular question for our listeners and followers. Many people have already asked me, and that has to do with the polycystic ovarian disease or polycystic ovarian syndrome. I think it's important because of polycystic ovarian disease, a lot of women unfortunately are infertile. A lot of them have unwanted hair growth. Many of them have insulin resistance. Many of them are obese. Many of them are just not feeling well. So please detail in as detail as you can. Talk about this PCOS.
Correct. Now, PCOS essentially is polycystic ovarian syndrome, which, if you break it up, you can say that there's something to do with cysts in the ovaries. So yes, there are multiple small cysts that are seen in the ovary, both the sides. And in terms, when we're talking about syndrome, it's not just something that's limited to the ovaries or the reproductive organs, but it also has its implications on other organs and other endocrine apparatus. Most commonly, we see that PCOS patients are associated with obesity. Eventually, they develop high blood pressure, sugar issues, and cholesterol problems. So this is something that is deeply intertwined. There are certain genetic bases to it. There are certain, environmental factors that could affect it. Stress, your lifestyle, all of that has an impact on PCOS, which is why, you see the modern woman struggling between managing her home, her work, her perhaps in countries like India, the in-laws, a lot of such things. All that stress somewhere keeps building up with no mechanism to vent it out. And these stressors, all the free radicals that it generates, also could be one of the causes why PCOS has become so common over this last few decades. If you look at the statistics, I think 3 out of every 4 women, or 25% of the population, if you look at it, have polycystic ovarian syndrome in a mild version or a moderate version or some form or the other. Now, the greatest impact or the first symptom that you would feel if you're perhaps having polycystic ovary is that you start to notice an irregularity in your menstrual cycle. Your menses could, instead of coming in every month, they start to come every 1.5 months or every 2 months. For some women, it becomes worse. It keeps worsening, and they might not menstruate at all till they are given some medicines, some hormones, which cause something what we call as a withdrawal bleeding. So if you started, facing these kind of issues, you must go and see your doctor Again, there are a lot of misdiagnosed PCOS. So a lot of doctors just say that, oh, you have an irregular cycle, okay, you are a PCOS. But it's not that easy. It's not just about treating your irregular cycles, but it's the entire endocrine problem that needs to be addressed too. So you need to run a couple of hormonal blood tests. You need an ultrasound scan. Um, you need then to start embarking on a weight loss journey, again extremely important to maintain your ideal weight. Even if you are a lean PCOS, there's a variety of people who are slim and trim, but they are still PCOS, or they're still suffering from this problem of irregular periods and cysts around the ovaries. And even though they are lean, they could always benefit from regular cardiovascular exercises, weight training, and a sensible diet, which is uh, low in saturated fats, which is low in simple carbohydrates, and rich in proteins and complex carbohydrates and fiber. So if they start to follow these basic things, a lot of the PCOD treatment just lies in lifestyle modification, meditation, yoga. These are other alternatives that perhaps the East has contributed here. In terms of period regularization, there are medicines that could be taken. Unfortunately, because to treat the hormonal problem, we are giving you more hormones that sometimes will also work as a contraceptive. So if you want an immediate pregnancy, that might have to be delayed till your PCOD problem is fixed and addressed. It normally takes between 6 months to 1 year for you to start to normalize your endocrine and your hormonal status, after which a pregnancy could be planned. So that's the infertility aspect. Again, we talked about sugar being an important aspect of PCOD patients. So if your insulin levels are very high, or if you're having an insulin resistance on top of or associated with PCOD, it would be wise to start you on basic anti-diabetic medicines like metformin, which will help you not only stabilize your sugars, but it also help you start to ovulate more regularly. PCOD patients are infertile because of this very reason, that they do not ovulate regularly each month. So metformin added there could help you with that. If your cholesterols are over the roof, you could be started on lipid lowering agents and lipid lowering drugs. Depending on other risk factors, maybe certain other vitamins could be added. Vitamin D again assumes great importance because because of this dysfunction with the fat metabolism and all of that. Sometimes you could be deficient with vitamin D. Amongst vegetarians and vegans, B12 is something that's many a times deficient, not directly related to PCOS, but that's also something that needs to be looked at and fits the profile of overall health and lifestyle. That is again something that could be tested. So a PCOD, reach your doctor in the right time. Make sure that the problem is diagnosed properly and then treated properly. Again, in PCOD women, very important to track their blood pressure, their weight lifelong, because it is also associated with the metabolic syndrome, and it puts you at a higher risk of having uterine cancers later on in life because of the excess estrogen levels that most PCOD women have. So these are the couple of things they need to take care of in the long run.
No, I think those are excellent points. And to repeat what you said, PCOS can be treated with lifestyle changes, may require some hormonal treatment, may require medicine like metformin. And I think in a good hands with a good doctor and a good mom giving her efforts, many of the infertility in PCOS can be overcome. I think I've seen many examples, including my own sister, that just with the help of regular exercise, lifestyle changes, eating healthy food, taking metformin, I think she was able to conceive a twin after like 11 or 12 years right in Ahmedabad. So I think
Right.
PCOS obviously is a concerning disease, but now I think we know enough about it that it can be definitely managed very effectively. One more question we had about PCOS, which many of our followers have asked, is that what is the best way to handle this unwanted hair growth, many times in the face, many times on the neck and other areas?
Well, it's not just the hair. I think it also comes sometimes with a lot of pigmentation, around the intertriginous zones. Now, unfortunately, once the hair grows there, there's no way that you can make it go away. So you would have to look at cosmetic options like, let's say, electrolysis or getting it lasered, uh, or waxing or bleaching or other things. But once the hormones start to get normalized, the problem that gives rise to this excess hair is the excess levels of androgen. As soon as you start to normalize those hormones, androgen levels start to decline. that's when new growth of such excess or male pattern hair would not happen. But the hair that's already there will definitely need to be taken care of by cosmetic procedures. For pigmentation, again, once the hormones are treated, the pigmented zones will not increase, but they may or may not reduce completely. So you could use cosmetic procedures like, again, you can use certain lasers to cause depigmentation. You could use sunscreen so that excess sun exposure doesn't cause further darkening, and various other things, which is why before all of this starts, it is advisable to see the doctor and make sure that the cause is treated, because certain things that once they happen, it's very difficult to absolutely get them back to the normal.
No, I think that's an excellent point, that the prevention is always the best option. And I think if you start in the early stage of PCOS, before this lot of unwanted hair has happened, you could avoid a cosmetic option. But at the same time, I think cosmetic option may be necessary. And if you follow the lifestyle, if you follow the proper care, then maybe the new hair growth and new pigmentation will not happen. So I think today we cover 1 full hour, a lot of great topics, a lot of great knowledge we kind of acquired from you. And all of our followers, listeners are obviously very thankful. We are definitely bringing you every 3 to 4 months and learning new things from you. And my last question is, what is your message? Because I see you as a very empowered woman, very successful, very accomplished, very kind, very easy to talk to, and obviously, a very good personality. So what is your message to all the women? How can they empower themselves? How can they follow in the footsteps like yours?
Well, I'm first of all, thank you so much again for your kind words. I'm humbled. I think I never see myself, or I never rate myself as being successful or being unsuccessful. I think that's the first thing that we should all do. Stop trying to categorize yourself that am I successful or am I not. You are what you are. You live in the moment, enjoy whatever is happening. If you have stressors in life, relationship problems, health issues, children problems, career troubles, you're not alone. There are I think billions and trillions of us in the same boat, having all these problems in various proportions. It's just that the way you handle it. If there are a lot, you'll always find a support system of people around you for whenever you are down. So that's important to reach out to that support system. Don't put these false facades around yourself that I can't ask for help, or I am high and mighty. All of us are in the same boat. We have certain resources, maybe less or more, but eventually it's all going to even out. Again, very important, I always feel that every day I should learn something. So I think the day that you feel that, oh, you've learned everything, you're either in a big away from reality, or you're probably dead, is what I say. That if the day you feel, oh, you know everything, you're probably dead, because then you have nothing more to do in life. So I think constantly try and learn new things. I don't have a hesitation learning from a sweeper. I don't have a hesitation, learning from a biomedical engineer if he has something to tell me. Similarly, I think we should start treating each other as equals. The first thing that I take as a compliment is that, and gracefully take it as a compliment, is that I'm easy to talk to. I think I should be, if I want to be a good doctor, I should first learn to empathize with the patient. And I try and apply it not just to the patients, but to everybody I meet, because you never know what that person is going through. Maybe he or she has had a bad day. So try to be empathetic to everybody that you come across. And at the end of the day, I tell everybody this: don't take life too seriously. Nobody gets out alive. So just take it easy. Things have a way of figuring themselves out.
Now, that's an excellent message to all the women. But actually, for even many men, I think many of us don't realize that, we have all the support available. We sometimes become macho, but I think, so that's a message just not only to all the women, but also to most men too, I think. So that kind of concludes. Great. Thank you again. Like I said, you are coming back
Thank
every
you so much.
month. And let me give you a quick update again. Again, we are at about 80,000 followers. We are doing this Facebook Live with all the great guests. 4, 5 times, 6 times a week. Please, if
Lovely.
you're on our page, please invite your friends and family to join our page. We all are together. We are like a team. We educate each other. We motivate each other. We make each other grow. We make each other happy, healthy, and live long. So thank you again, Dr. Vasavada. See you again.
Thank you so much. Have a great day. Take care. Bye bye.
Bye.